Metatarsalgia is kind of a catch-all term that basically means pain in the foot. It happens because of a collapsing metatarsal arch. This collapsing results in the compression of all those soft tissue structures that are found there at the metatarsal head level. If you think about the forces that are on the foot, we have some pretty substantial forces that occur throughout the day. We have simply when we're walking, anywhere from 1 to 1.2 times our body weight. Running, that amount goes up to 2 times our body weight. And if you are jumping as something as small as a 2-foot height, it can be up to 5 times our body weight. And so there's going to be a lot of pressure there. So when we talk about mechanisms of injury, there are several things that can lead to this pain in the ball of the foot. Hammer toe is going to cause an increased pressure on the plantar surface of that involved toe. A dorsiflexed first ray will increase the plantar pressure on the other 2 through 5 metatarsal heads. If you have excessive activity on the ball of foot due to increases in distance intensity or frequency, that can increase the pain there. Excessive weight gain can cause problems, even if it's short term, such as during pregnancy. Fatigue can cause problems, as well as high heels. Additionally, there are certain foot types that can lead to a specific problem called Morton's toe syndrome. Morton's toe is defined as when the first toe is shorter than the second toe, which you can see on the far left picture. We have in our population basically 3 different types of feet, and you can see those types here. About 69% of the population has that middle type, that Egyptian type. This Egyptian foot simply means that the first toe is the longest toe. Morton's foot is also known as that Greek type, or that Greek foot, and about 22% of the population has that. That is again defined as when the first toe is shorter than the second toe. The last foot type is in about 9% of our population, and that's when the first and second toes are even. So when you have Morton's foot, you have an increased risk for having that pressure due to Morton's toe. So signs and symptoms that you will see include calluses that are formed, most often under the second and third metatarsal heads. Your patient will complain of nagging pain in the metatarsal head area. That pain comes and goes as they are doing their activity. Range of motion will be within normal limits for those toes. There are no special tests that are available, although when you are testing specifically for a neuroma, there will be a test that we will discuss. Manual muscle testing, we will test the toe flexor specifically. We will also want to perform a differential diagnosis and look for stress fracture. Treatment-wise, we are often going to create a beveled metatarsal teardrop pad. This teardrop pad is placed proximal to the metatarsal heads, and therefore it transfers the pressure from the painful metatarsal head to the tolerant areas. We may also use orthoses to help limit the subtalar joint pronation. This will also reduce pressure on the second and third metatarsal heads. As I kind of alluded to, you can end up with something called an interdigital neuroma, most often called Morton's neuroma. This occurs when you end up with an entrapment of the medial and or lateral plantar nerve, and that will be somewhere adjacent to the metatarsal heads. The mechanism of injury is simply an increased activity on the ball of the foot. If a person has hallux valgus, that can also lead to this problem. Signs and symptoms. you can see listed here, they will complain of pain in the anterior metatarsal region that radiates into the toes. A nodule can be felt at the site of the neuroma, and actually people will feel like it's easier to walk around in bare feet or less painful to walk around in bare feet. The pain will worsen when they put their shoes on because the shoe starts putting pressure on that nerve. One of the hallmark signs is someone that says that it feels like there's a pebble in their shoe. But when they take their shoe off, obviously nothing is there. The special tests that we can perform include a pencil pressure test, and a squeeze test. These tests are not going to help rule in, rule out metatarsalgia. They are more specific to helping determine if there is a neuroma that has formed. Because it involves the nerve, there will be some type of neurovascular problem, such as numbness and or radiating pain. Usually it's going to be on the plantar surface of the foot and is going to radiate into the foot and toes. Treatments can include corticosteroid injections or surgical excisions